Hey everyone, my name is Tolqueen, aka Chucky Bartolo, and welcome to Revealing Sex Ed, a 5-part Pride special that's going to answer all the hard and deep questions about sex everyone was too afraid to answer growing up. It's never too late to learn, and today we're going to be focusing on HIV, the myths that surround the virus, and the medication that's available out there. This show is possible thanks to the help of Catena Media, the Health Promotion and Disease Prevention Directorate, and the Ministry for Health, so shout out to them. The first thing I really want to clarify before we move on is that being diagnosed with HIV is no longer a death sentence. With medication and treatment, people who have contracted the disease can now lead perfectly normal lives. However, before we diagnose into diagnosis and prevention, let us take a look at some facts. Globally, there are estimated to be over 35 million people living with HIV. But perhaps due to a lack of awareness among many other factors, Malta registered the EU's 3rd highest increase in new HIV cases last year. This doesn't mean that we should all start panicking and running around, but it does make videos like this and any others that are there to consistently remind you to always wear protection all the more important. There's a lot of myths that surround the virus, which leads to misinformation and a terrible stigma to those who are affected. So let's bust a few of those myths wide open right now. Number 1, it only affects gay people. Wrong. While it's true that HIV is more prevalent in men who have male sexual partners, it is not limited to one group alone. Number 2, you can get HIV by touching someone who has it. Wrong again. HIV is transmitted through infected bodily fluids, namely blood, semen, precum, vaginal or anal secretions, and breast milk. Number 3, someone with HIV sneezing or sweating near you is going to pass on the virus. Also incorrect. There is no HIV in sweat, tears, urine, or spit. So technically this also means that kissing is safe, but there's a bit of a grey area due to the potential for open wounds and sores in your partner's mouth and gums. And finally, number 4, what if I get it from a mosquito bite? A fun fact, you can't. Mosquitoes don't spit other people's blood into your system, just their own saliva, which I know is a bit disgusting anyway, but good to know in this context. Unlike malaria and other mosquito-borne diseases, HIV does not survive outside or in the mosquito's gut, so it cannot be transmitted this way. But enough about rumors and prejudices, let's talk about the real deal. Before treatment, we're going to look at diagnosis, and there's 2 main routes to go down. The first is making an appointment at the hospital's GU clinic, which will be covered in more detail in a later video, and the second is through self-testing kits. If you go for the former, namely the GU clinic, always tell them if you suspect that you may have come into contact with the virus, as otherwise you may get an extremely delayed appointment. And please, most importantly, never lie to them. On the other hand, self-testing kits can be bought from several pharmacies across the island and can give you a result in around 15 minutes. They cost roughly €40 and come with simple to follow instructions. It's very important to know that if your result does show up as a positive, you must call the GU clinic immediately to book an appointment. Firstly, the test may be reporting a false positive, and secondly, even if it's not a false positive, you need to start working towards treatment as soon as is possible. This brings us to our final part of the video, namely preventative medication, and in this case we're talking PrEP and PEP. So let's get the acronyms out of the way. PrEP stands for pre-exposure prophylaxis, aka a preventative medication that lowers the chances of infection. PEP, on the other hand, is post-exposure prophylaxis and is sometimes referred to as the morning after pill of HIV treatment. While these drugs have been on the market since around 2012, they've only recently made their way to Malta, and the 2017 general election saw them take center stage when it came to both parties' LGBT+ manifesto. But how do they work? PrEP is taken by HIV-negative people as an oral pill every single day and greatly drops the risk of HIV infection if it's been taken for at least 7 days. On the other hand, this does not mean that anyone on PrEP should just stop using protection altogether. Always, and we mean always, wear a condom. PEP is also a preventative strategy and is used within 72 hours of exposure to the virus. This means that you need to act quickly, but if you do, there's a chance of greatly reducing the risk of infection even after being exposed to it. These are usually purchased from the hospital's GU clinic, but if it's closed and you're in a rush, please contact the emergency department. The downside to all this is that despite its potentially life-saving implications, PEP currently costs around €600, which is simply not a feasible option for some. The current government in Malta has promised to make PEP free of charge in Maltese hospitals, and while we're not there yet at the time of filming, sources close to the health ministry have told us that it is still a priority to them. Of course, as many of us know, HIV and AIDS are extremely sensitive subjects within the LGBT+ community, and this video aims to bust some myths and talk about the current situation, but it is in no way meant to be taken as official medical advice or to be the be-all and end-all video on the subject. It is so hard to cram 40+ years of information into 5 minutes, so I strongly encourage everyone to go out and do their research carefully after watching this. For more information, visit www.sexualhealth.gov.mt or call the GU Clinic on 2122 7981 to book an appointment. And we will see you tomorrow.